This is Kate O'Rourke with RT Image Magazine. I'm here today with Dr. L Hixson of American Mammographics. Dr. Hixson has been in the field of mammography for over 25 years now and has seen a lot of changes. Dr. Hixson, how is your technology helping improve the field of mammography?
Well, about 14 years ago, I recognized that we needed to try to do a little better job on solving some of the problems that we were seeing. And I developed some spot compression devices, and I have a unique feature of one of my devices. It has a cone on a platform, and it permits you to get double spot compression. So actually, all of the good things that happen with breast compression can be maximized if you can get double focal compression. And we can see that it helps in the decision-making process to determine whether we're going to have to biopsy a patient or whether we can ignore it or put the patient in a 6-month follow-up category.
Can you tell me a little bit about the mammograms that you have here and what the differences your technology has made?
Yes, previously all of my devices were designed exclusively to solve known problems, but I've developed about 2 years ago a compression device that can be used for screening, and it has the advantage of it has a curved downward sloping surface, and this permits us to get better compression of the mid-breast and anterior breast, which you don't get with a conventional horizontally coordinated compression pattern.
And what are the benefits of your products to the women that are having this cancer?
Well, actually, the majority of patients find that the mammogram is more comfortable because we don't have to over-compress the posterior breast. We can get the rest of the breast out of it compressed.
And how do you think this is going to improve the overall field, or what direction do you think this will take mammography in?
Well, we know that we have a problem in finding cancers in patients with abundant fibroglandular tissue and real dense breasts. With a fatty breast, we probably only miss about 2% of the cancers, but as the breast tissue increases in amount, we find that we're failing to demonstrate a lot of cancers. In fact, patients that have very abundant fibroglandular tissue, it's been shown that we miss as many as 50% of the cancers in these extremely dense breasts. So the fact that my panel is improving the compression of the mid-breast and anterior breast, we're able to diagnose things in the anterior 2/3 of the breast that might otherwise be missed. Whereas this is a film taken with my new S.O.F.T Paddle, and you notice that we're penetrating this dense, quiet fibroglandular tissue and we're bringing out areas of radiolucent fat, which could highlight a small cancer that might be missed if you use the conventional pattern.
Sounds great. Thank you so much for your time, Dr.
Okay, thank you.
You have a great show.